Assalamu alaikum everyone. Today we are going to start the valvular heart diseases. In this video we will discuss the aortic stenosis. So what is aortic stenosis? It is incomplete opening or narrowing of the aortic valve. It is one of the most common cause of valvular heart diseases in the older age group. Now come to its causes. Causes includes the calcification of congenital bicuspid aortic valve. Normally the aortic valve in healthy individuals is tricuspid. There are three cusps of aortic valve, but in some individuals there is bicuspid aortic valve. There are two cusps and these are calcified in at the later stages. So the calcification of congenital bicuspid aortic valve is one of the cause of aortic stenosis. The other causes includes calcified tricuspid aortic valve in the elderly and rheumatic heart diseases. The most commonly valve to be involved in rheumatic heart disease is mitral valve, but the second most common valve is aortic valve. So these three are the major causes of aortic stenosis. Now come to the symptoms of aortic stenosis. Let's talk about its little bit pathophysiology first. Due to the stenosis or narrowing of the aortic valve, there is a outflow obstruction that blood will not eject into the aorta properly due to the obstruction in the pathway. So the stroke volume is reduced. Ultimately, there is reduced cardiac output because of the obstruction in the pathway. Due to reduced cardiac output, there is reduced blood supply to the brain, especially when the patient doing exercise or during the exertion. There is reduced cardiac output and reduced blood supply to the brain. It leads to exertional syncope. So it is the important feature of aortic stenosis that exertional syncope occurs in these patients. And due to decreased cardiac output, there is reduced blood supply to the heart, that is reduced perfusion to the coronary arteries and decreased blood supply to the heart as well. And due to the obstruction, reduced blood supply leads to decreased coronary artery perfusion, and due to obstruction in the pathway, there is pressure overload on the left ventricle. Due to pressure overload, hypertrophy occur, left ventricular hypertrophy occur due to the pressure overload. So due to this left ventricular hypertrophy, there is increased oxygen demand of the myocardium as well. So there are two reasons for developing the ischemia in these patients. One is due to left ventricular hypertrophy, increase oxygen demand, and the second is decreased cardiac output, reduces the perfusion of the coronary arteries as well. So these patients may face the angina or the ischemia during the exertion. So this is the second classical feature or the symptom of aortic stenosis. And due to continuous or persistent left ventricular hypertrophy and pressure overload, it may ends up with the dilation of the left ventricle at the later stages or in the advanced stages. So due to dilation of the left ventricle, regurgitation, and due to volume overload and pressure overload, regurgitation of the blood occurs into the left atrium and from the left atrium into the pulmonary circulation. So there is a pulmonary circulation overfilling, and due to increased blood in the pulmonary circulation, pulmonary edema and pulmonary congestion occurs, which leads to dyspnea in these patients. All the features of left sided heart failure occurs in these patients at the advanced stages. So dyspnea is the third classical feature or the third classical symptom of aortic stenosis, that is difficulty in breathing. This triad is very important in the aortic stenosis, and all these features are developed on exertion or severe or strenuous exercise only, not at the resting stage. And these features may lead to sudden cardiac death in these patients. Now come to the clinical signs of aortic stenosis. Due to the obstruction in the pathway in the blood from left ventricle into the aorta, so during the systolic phase, ejection murmur is occurs during the systolic phase. This is called ejection systolic murmur due to obstruction in the pathway. When there is a contraction of the left ventricle and there is obstruction in the pathway during the systolic phase, a murmur can be heard. This is ejection systolic murmur. It is also called crescendo decrescendo murmur. That is, crescendo means increase in intensity and decrescendo means decreased in intensity. Initially there is murmurs intensity is increased gradually when there is a systolic phase. After that, during the relaxation phase, and there is a little bit decreased in the murmur intensity. So there is initially increased in murmur intensity and then there is decreased in the murmur intensity. This murmur is also called diamond shaped murmur. that this gives the shape of diamond. So this is called crescendo decrescendo murmur or diamond murmur. Initially increase intensity during the systolic phase, and during relaxation there is decreased intensity of the murmur. So this is crescendo decrescendo murmur or diamond murmur in aortic stenosis. When there is a overfilling of the left ventricles, especially the increased preload when there is a uplifting of the legs or patient is lying down, due to overfilling of the left ventricle, it increases the intensity of murmur. So increased preload increases the murmur intensity, increased preload increases the intensity, and decreased preload at the upright or standing position decreases the intensity of the crescendo decrescendo murmur. Now come to the next clinical sign, that is pulsus parvus et tardus. Due to obstruction in the pathway, there is low volume and slow rising upstrokes of carotid pulse, upstrokes of carotid pulse. So this slow rising and low volume pulse is called pulsus parvus et tardus. This is the carotid pulse. It is a classical feature of aortic stenosis. The other features or the clinical signs includes soft S2. This S2 sound is due to the closure of aortic valve and pulmonary valve during the diastolic phase, during the filling phase. But due to thick and less motile or less mobile aortic valve in aortic stenosis, no proper closure occurred during the diastolic phase as well. So there is soft S2 sound in aortic stenosis. Next feature is heavy apex beat or thrusting apex beat. This is due to increased pressure in the left ventricle or the pressure overload in the left ventricle. So there is thrusting or heavy apex beat in aortic stenosis. And the other features are narrow pulse pressure. So what is pulse pressure? It is basically the difference between the systolic blood pressure and diastolic blood pressure. Normally the systolic blood pressure is 120 and diastolic is 80. So the difference between systolic and diastolic is 40. Normally the pulse pressure is 40 millimeter of mercury, but in these patients there is narrow or reduced pulse pressure because of obstruction in the pathway. There is reduced stroke volume. So reduced, due to reduced stroke volume, there is reduced systolic pressure. So reduced systolic pressure and reduced diastolic pressure, there is narrow pulse pressure in these patients because of this reduced stroke volume. And there is S4 sound is produced in the aortic stenosis patient. This S4 sound is because of when the atria contracts against the stiffened and thick left ventricle, there is a pressure overload. So S4 sound is produced due to this pressure overload. And the signs of heart failure occurs in these patients at the advanced stages of aortic stenosis, as we have discussed that this hypertrophy may ends up with the dilation and regurgitation. Ultimately the left ventricular failure occurs in these patients. So these are the clinical sign and symptoms of aortic stenosis. Now come to the investigations of aortic stenosis. ECG, it is a non-specific. ECG shows the left ventricular hypertrophy features and left bundle branch block features in these patients. For ECG, watch my videos on the series of ECG, in which I have given the detailed explanation of ECG interpretation. Now come to the next investigation, that is chest X-ray. In the chest X-ray, the chest X-ray may be normal in aortic stenosis, or there is left ventricular dilation in the later stages. And also there is calcified aortic valve in these patients, calcified aortic valve from the lateral view of the chest X-ray. So these two are the features on the chest X-ray. The gold standard or next investigation, that is echocardiogram. It is the gold standard investigation or the investigation of choice for in aortic stenosis. In the echocardiogram, there is a calcified, thick and less motile, calcified and less motile aortic valve and left ventricular hypertrophy. These two are the findings in echocardiogram, and this is a gold standard investigation. Sometimes a Doppler echocardiogram is important to check the severity of aortic stenosis. Basically, it is used to check the pressure difference between the aorta and the left ventricle. In the left ventricle, due to the obstruction in the pathway, there is high pressure, and due to decreased stroke volume or decreased ejection, there is low pressure in the aorta. Ultimately, the difference between the ventricular and aortic pressure is high. So the gradient between the ventricle and the aortic pressure is high gradient, and this is checked by Doppler echocardiogram, and it is used to measure this, it is used to check the severity of aortic stenosis by this pressure gradient. The next option is cardiac catheterization. It is alternate option if it is not diagnosed by aortic stenosis is not diagnosed by echocardiogram. Then the next option is cardiac catheterization, in which catheter is inserted and there is a measurement of pressure between the left ventricle and the aorta, and also it is used to identify the associated coronary artery diseases along with the aortic stenosis. So these are the investigations. Now come to its management of aortic stenosis. If the patient is asymptomatic, then no need of any treatment, just conservative management. If the patient has low risk or low or moderate risk of moderate risk for surgery, then SAVR, that is surgical aortic valve replacement. SAVR is important in these patients, that is chest or the thorax is opened by the surgery and by prosthetic valve is implanted in these patients by replacing the stenosed aortic valve. And the next important treatment is TAVR, that is transcatheter aortic valve replacement. This is very important for high risk patients for surgery, in which the surgery is there are risks for surgery or high mortality with the surgery, and especially the older individuals or very elderly persons. This TAVR, that is transcatheter aortic valve replacement, that is catheter is inserted into the heart and through catheter valve is replaced. And the next treatment option is aortic balloon valvuloplasty. As the name indicates, that catheter is passed from the aortic valve, and there is a inflation and deflation of balloon. Due to inflation and deflation, there is a stenostic point is opened by this balloon, and it is usually done in children and infants, in which there is a bicuspid aortic valve. So children and infants, the treatment option is aortic balloon valvuloplasty. So this was all about aortic stenosis. Thank you so much for watching this video.